During these difficult times, many people wonder if pre-existing conditions increase the risk of COVID-19 infection. Therefore, I wanted to tackle if diabetes possibly increase the risk of COVID-19 infection. Those with type 1 or type 2 diabetes are often always susceptible to worse outcomes when sick, simply because blood sugar gets more difficult to manage. High blood sugar levels can interfere with white blood cells' ability to fight infection. In this video, I would like to collect scientific information to confirm the correlation between having diabetes as a pre-existing complication and susceptibility of COVID-19, which may introduce possible health recommendations to reduce the risk of contracting COVID-19. What is COVID-19? COVID-19, or the coronavirus, is a newly discovered respiratory disease with symptoms and outcomes ranging from mild to very severe. The ongoing global outbreak is killing millions of people, causing severe rules and precautions to be set in place in order to reduce the amount of individuals contracting the virus. Symptoms may include shortness of breath, fatigue, diarrhea, sore throat, loss of taste and smell, fever, and many other symptoms that can appear 2 to 14 days after exposure to the virus, according to cdc.gov. And now for a general definition of type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease with antibodies to pancreatic beta cells. The insulin deficiency must be treated with exogenous insulin, such as injection, pump, etc. Type 2 diabetes, on the other hand, develops gradually as insulin resistance or prediabetes progresses. It can be treated through oral hypoglycemic agents and insulin therapy. Losing body fat, exercising, and maintaining a balanced diet is recommended as well. So now you might be wondering, how could diabetes be related to COVID-19? People with high blood sugars have a weaker or suppressed immune system, especially diabetes that is poorly cared for. Therefore, if one's white blood cell count is affected, fighting infection is harder for the body. Additionally, when the body must defend the virus, it releases hormones that can sometimes raise blood sugar levels, raising how much insulin one needs, which is very risky for diabetic people if this is not managed. Hyperglycemia in diabetes is thought to cause dysfunction of the immune response, putting a diabetic patient at very high risk of dangerous or fatal outcomes. So in this case, if you put together the beta cell damage in, let's say, type 2 diabetes, as well as the insulin resistance, the drugs that the person already takes, this can all develop a very poor immunity in the patient and causing the person to be more susceptible to contracting COVID-19. COVID-19 can drastically raise a diabetic's blood pressure levels, and high blood pressure level can lead to dehydration. According to Harvard Medical School, if you have type 1 diabetes and your blood sugar rises above 250, you could be at risk for ketoacidosis, which occurs when the body burns fat for energy and creates high levels of blood acids, known as ketones. Eventually, these ketones can poison the body. During the coronavirus outbreak, it's especially important to keep your ketone levels down and avoid trips to the ER when possible. Although having diabetes does not guarantee that an individual will contract the virus, the chance of infection is higher due to a weaker immune system. Mortality rate is higher if the person fails to take their pills or insulin. And now for some recommendations and suggestions if you have diabetes. Diabetic people should rectify their treatment of diabetes if they fail to manage their blood sugar levels properly. They must continue taking their pills and insulin. Those that are diabetic, but also dealing with obesity, should attempt at-home exercises during this time, since outdoor activities are restricted in some areas. They should also check their temperature and weight more frequently than before, because losing weight without trying is a sign of high blood glucose. Last but not least, those who are at high risk for contracting COVID-19, have pre-existing conditions and complications, should fully follow the health precautions and protocols enforced by professionals that are just trying to help. This means wearing a mask at all times in public or in crowded areas or any time having contact with people, even family members that aren't those that you live with. It is important also to quarantine or isolate yourself if you have been in contact with somebody with COVID-19. Continue following the social distancing guidelines and, of course, always wash your hands.